Otorhinolaryngology in the UK, based in the East Midlands. This was an audit carried out in my final year of medical school, and it was throughout the COVID pandemic that I was working in primary care. So that's essentially family medicine, or general practice as we like to call it in the UK. And this audit was based on the 2-week wait cancer referral pathway for head and neck cancers. So a little bit of background about this audit, or my interests and why I did it. Approximately more than 12,000 head and neck cancers are diagnosed in the UK every year, and there are 4,000 deaths related to it. Obviously throughout the pandemic, one of our biggest concerns was without face-to-face appointments, because they were cutting down the number of patients coming into the practice. The biggest concern is that this would impact the number of patients that we would be referring on urgent pathways like this, because of the lack of face-to-face contact. Instead, we resorted to telephone and video consultations. And it's widely known that the lockdown was associated with decreased access to clinical services and cancer screening services. So obviously the majority of patients, they develop their symptoms before diagnosis, and they might present to primary care, so to their local GP, numerous times before they actually are referred on a cancer pathway. And a recent survey by Cancer Research UK reports that 53% of general practitioners are concerned, saying that fewer of their elderly patients are contacting them with their symptoms in comparison to prior to the pandemic. So we did a simple audit to have a look at actually how adversely are our numbers being affected within our general practice. So just to give you a bit of context, so the GP that I was working at the time is a care provider for approximately 9,000 patients in the East Midlands. We have 4 general practitioners and 4 nurse practitioners. Okay, so this is the UK cancer wait time target. Essentially, anyone who comes in with symptoms that are suspicious of malignancy or something sinister, then we should refer them on the 2-week wait cancer referral for head and neck cancers. That also includes any sort of ENT conditions in there as well. We put that in with the head and neck cancer referral. And this should be only 2 weeks, so that should be ideally this patient, as soon as they come to our practice, in theory they should be investigated in secondary care, where we can either rule in or rule out whether they have something sinister or not. And if they do have their cancer, so that it's been diagnosed, then the treatment itself they should be commenced on treatment within a month's time. Okay. So this is just an overall idea. So this isn't specific to head and neck cancer. It's looking at all the referrals for cancer that we did in our practice. So this is going back as far as 2017. We looked at all the cancer referrals we were doing in our practice. And I guess this it gives us a simple appreciation of, if you look at, so the UK went into lockdown as of March 2020. So the year that that we are seeing the biggest dip in referrals is 2020, and it's the time of when we went into lockdown, approximately around here. But then as the lockdown phased out and people were having more face-to-face contact, then you can see our referrals are picking up again. So that's just a general snapshot. This is to show you out of all the referrals, what types of referrals were being made over the years. So that's just in the UK, we've got set pathways for how we do our referrals for cancer. And these are basically our categories. And for head and neck, it looks like in 2020, we had more than we normally do. So what this audit essentially strove to do, we had a look through all our patients that presented with a certain presenting complaints. We'll look through the pro forma that we use for the pathways in a moment. So and essentially we wanted to gather information on the time period from when patients were first presenting and when they were eventually referred. So obviously in primary care, we can have patients visit numerous occasions before we actually do a referral. So that's why that was in there. And then we wanted to know what's the time frame from once they've had their referral to actually receiving a diagnosis. So the CWT cancer wait times for the UK, ideally patients should be receiving their diagnosis within 28 days. That's the standard. And then we wanted to compare, so obviously we went into lockdown in March 2022. So we were comparing these 2 years. So obviously COVID-19 did start at the tail end of December, but in terms of our lockdown and when we stopped seeing patients face to face, it was in 2020. So we'll just be comparing those 2 years, and I will treat 2019 as a sort of pre-COVID phase and 2020 as when we were officially in lockdown and didn't see anyone face to face. So the standards used for this audit are essentially all patients should be seen in secondary care if they've been put on a 2-week wait head and neck cancer pathway. That's our current standard. And obviously all of these referrals should be appropriate, and I'll show you the pro forma that we use to make sure that we're hitting the right criteria, so there's no inappropriate referrals. And those who are diagnosed with cancer, they should have received their diagnosis within 28 days. So that's the cancer wait time target for the UK for diagnosis. So then how did I go about this? In the UK, we have various sort of softwares that we use. The most common ones are System 1, and there's some others out there. System 1 essentially is a centralized database. It's got it follows this sort of, they have clinical terms that form read codes. So if a patient has sore throat, or they've come in with otorhinoalryngology, that would be a read code, and I could do a search and find everyone who has come in with this certain read code. I'd be able to generate a report of everyone with a certain read code. So it can be a read code for a presenting complaint, or even a diagnosis in itself. So we found when we were comparing the 2 years, so pre-COVID is our 2019 year and COVID is our lockdown year of 2020, the patients that we pulled from our report, we had 14 patients that had head and neck cancer referrals in 2019 and 20 in 2020, and the mean ages you can see there. So this is sort of snippets of what the pro forma that we use when we do a referral for head and neck cancer. So obviously we have essentially, these will also have codes that are linked to the software that we use. So if someone has got certain symptoms or things that are found on the clinical examination, we can code that in the software as well. So if they meet any of this criteria, that will automatically generate a referral on the 2-week wait pathway for our patient. And so some patients, so this table here is essentially showing us how many appointments did patients have before we actually did a referral. So prior to COVID, most of the patients, they had only 1 or 2 appointments, probably because they were in person. And so if you were you can do an examination then and there. You're not worried about calling them back in several times over the phone or trying to do an examination virtually. So most patients, we had referred them quickly, and the same is the case for even throughout lockdown. So these consultations, you have to appreciate, would have been done over the phone or via video. And some people had to have or at least one person had up to 4 appointments before the actual referral was made. And as you're aware, if somebody is presenting with numerous accounts of a certain symptom, that in itself becomes sinister. And so that's why probably the referral was made. So then this is the data from the proforma. So looking at the patients that came in with their different presenting complaints, and it shows us what types of presenting complaints patients were essentially coming in with. And it's just to give you an appreciation of, okay, so a lot of people who had oral tumours and essentially sore throat or hoarseness of voice. These would have been documented on the proforma that I showed you earlier. And we would have referred them by the head and neck 2-week wait pathway. So days from referral to diagnosis. So obviously we know that the moment they come in from primary care, they should have been seen in secondary care within 2 weeks. That's the 2-week wait pathway. And then from referral time to diagnosis, the standard is 28 days. And in this graph, it's basically showing us if they met the 28-day target or not. So annoyingly, this is the wrong way around. Ideally, we'd have 2019 on the left-hand side and 2020 on the right. But you'll have to bear with me. So essentially in our 2020, it looked like a lot of our patients were having, so this is the year that we had lockdown and fewer sort of clinical, or at least we were worried about patients presenting later and having less access to healthcare because of either fear of leaving the house or for X number of reasons, but obviously being in a state of lockdown. Here, patients were having their diagnosis at a lot later date than, or at least exceeded the target, which is 28 days. So we were meeting the target quite well in 2019 prior to COVID, prior to March 2020 when we were in lockdown. And then just looking at the clinical outcomes. So many patients we could reassure and discharge. Others, they had benign pathology, which still required investigation. And then those who had malignant pathology and second clinic review. So these are patients that were under still investigations for what types of treatment they might need for their malignancy. So from presentation to diagnosis, so pre-COVID, this is essentially just the number of days. So these are actually individual patients broken down. So you can, this graph is essentially saying how long did this patient actually have to wait from the day that they were referred, from the referral to their to actually receive a diagnosis, and then from from referral to diagnosis is in blue, and this is from diagnosis from presenting in primary care. So this was prior to the pandemic for each individual, and this is post. So this is in the thick of lockdown. How long were people having to wait? And one patient having to wait up to almost half a year, possibly longer, to even receive. So dark green is to even receive a diagnosis. So in summary, 2019, so we're treating that as our pre-COVID year, but 3/4 of our patients, they met the cancer wait time, of they were getting their diagnosis within the 28 days. And in lockdown, this was reduced, and only 60% of patients did meet this criteria. The average number of days from referral to diagnosis did not change substantially, though. So it's about 30 days from referral to diagnosis. And the number of days from first presentation to diagnosis did increase by about 2 days, suggesting that patients were delaying their visit to primary care, or not being able to receive an appointment, a telephone appointment. So just to conclude, this project has highlighted that our practice was actually meeting the 2-week wait targets, despite the pressures of the pandemic, and despite the increase in the average number of days to referral, there's also an increase in the number of follow-up appointments. And so that means that patients were being appropriately followed up, and they were having their safety netting advice, and they were representing if they were having issues. And thank you for listening. That's the end of my presentation.
Thank you, Dr. Tabitha.